Hola, sean todos muy bienvenidos.
Hello and welcome everyone. The decade of healthy aging is a historic opportunity to work together in order to improve the lives of all older adults, their families, and the communities they belong to. In order for the decade to be a success, we must have access to different types of knowledge. My name is Patricia Morsch, and I'm a technical officer at the Healthy Aging program at PAHO. And today I have the pleasure of being the moderator for this event, whose aim is to launch the Healthy Aging Decade platform in Spanish and promote the knowledge exchange and collaboration between and among everybody joining us today in order to foster healthy aging. Before we begin, let me give you some directions regarding the Zoom platform. This webinar will be broadcast in three languages, English, Spanish, and Portuguese. Please choose your preferred language. In order to access that language, please click on the interpretation icon on the bottom bar of your screen, and there you can pick the language that you would like to listen to. Please use the Q&A icon in Zoom to ask questions which will be answered in writing or during our panel discussion. If you can have conversations with other participants using the chat icon. This will be broadcast through the YouTube Live channel, and it will be recorded and be available after the meeting in our channels. If you're joining us via YouTube, you can always participate of the conversation by sending us comments and using the hashtag adding life 2 years. Now, and to begin this event, I would like to invite Dr. Andrés de Francisco, Director of the Department of Family Health Promotion and Life Course at PAHO, to give us his welcoming remarks. Thank you very much, Patricia and colleagues. Welcome, everyone. On behalf of Dr. Carissa Etienne, PAHO Director, I would like to welcome you to this very important session to launch the Healthy Decade platform. The period between 2021 and 2030 was declared the Decade for Healthy Aging by the United Nations. The decade is a global collaborative strategy that will bring together the different sectors of society to promote a world where everyone can live longer and healthier lives. In addition to the global epidemiological and demographic changes that drove the development of the decade, the current scenario of the COVID-19 pandemic emphasizes the importance of taking action to protect our older adults. Among the enablers of the decade of healthy aging are the ability to connect stakeholders all over the world so they can share experiences and learn lessons, and thus strengthen leadership and capacity to take appropriate and integrated action across different sectors. Today, we welcome the new multilingual decade for healthy aging knowledge sharing platform. The platform offers a central place to find, share, and generate knowledge, as well as to support networking on healthy aging. At this event, with emphasis on the Spanish platform. Together, we can add life to the years during the decade, and the platform can help you to perform these activities. Thank you very much to all of our attendees and participants. Have a great event and see you at the platform. Thank you very much, Dr. De Francisco. Like Dr. Andrés De Francisco said, the Decade Collaborative Vision includes not only different sectors and disciplines, but also regions and languages. The development of the Decade knowledge sharing platform would not have been possible without support from our WHO regional offices. I am honored to welcome the 6 WHO regional directors who are joining us via video to make some remarks.
It is with great pleasure that I participate in the launch of the Knowledge Exchange Platform for the UN Decade of Healthy Aging. The Western Pacific region has one of the largest and fastest growing older population in the world. As people live longer, the society can benefit from more older people with experience, skills, and knowledge working and contributing as employees, investors, consumers, caregivers, or volunteers. However, to capture this opportunity, the society needs to transform itself to become age-friendly and support older people to stay healthy and continue social participation. Since this social transformation is unprecedented, there is no best practice. Countries need to experiment different options and learn from each other's experience. Aged countries can learn from new initiatives and innovations from younger countries, while younger countries can inform their policies and programs based on past experience of aged countries. I welcome the launch of this platform, the first global knowledge base on healthy aging. I look forward to the exchange of knowledge and innovation across countries and opportunities to learn from each other.
The platform for the UN Decade of Healthy Aging delivers a global good that is central to enabling older people to be and do what they value. That good is knowledge. The knowledge of communities, of caregivers, of policymakers, and of older people themselves, working to enhance their health and well-being in a diverse range of settings and with access to a diverse range of resources. By contributing to the platform, stakeholders from across the Southeast Asia region and the world can empower one another, leveraging best practices, data, and training to meet the unique health needs of older people, whatever their requirements and whatever community they come from. Because the future we want for present and coming generations is a future in which all people of all ages can fulfill their potential in dignity and equality, leaving no one behind.
The new platform for the UN Decade of Healthy Aging is a unique opportunity for everyone in the European region to work together across sectors to improve the lives of older people. In the spirit of our European Programme of Work, EPW, United Action for Better Health, we will promote knowledge sharing across our 4 flagship initiatives to protect older people's mental health, increase their access to vaccination, improve their digital literacy, and understand behavioral factors. These initiatives and the new platform will help us create a world in which all people can live long, healthy lives.
Greetings, friends in the Americas and around the world. Through our technical cooperation and advocacy efforts, PAHO continues to demonstrate our commitment to improve the lives of older persons. Because of this, we have been hard at work for years on the Decade of the Healthy Aging, which will be launched officially on October 1st, the International Day of Older Persons. Today, we are launching the Decade's Healthy Aging platform, which will be the main space to collaborate, share knowledge, and connect key stakeholders all over the world to work towards healthy aging. Sharing best practices and experiences can improve efficiency and inspire actions from the local level up. I encourage countries and territories in the region of the Americas to actively join the movement for the decade of healthy aging by learning together and connecting with other actors through the platform.
To foster the implementation of the decade of healthy aging, we need to engage decision makers, older people, their family members, caregivers, experts, and communities. The new digital platform for healthy aging is an essential resource for exchanging experiences, building knowledge, and harnessing wisdom for positive change. I urge all our colleagues and partners to use it.
At the recently concluded WHO Regional Committee for Africa, the continent's health ministers agreed that addressing population aging is a priority. But countries and their partners are not yet equipped with the data and evidence needed for action. So, I'm thrilled to share with you all a new knowledge exchange platform for the United Nations Decade of Healthy Aging. The platform will help governments, civil society, businesses, and researchers find, share, and develop policies and interventions to help older people lead healthier lives. I encourage all stakeholders to use this new platform to accelerate action to make our world a better place in which to grow older.
Muchas gracias a los directores regionales.
Thank you very much to the WHO regional directors for their collective calls for greater collaboration, sharing and learning to improve the lives of older people, their families, and their communities. Today, we also have the privilege to have an interactive multisectoral panel with representatives from Chile, CELADE, civil society, the Global Coalition on Aging, and the Latin America Academy of Elder Medicine. I would like to remind our audience to feel free to use the Zoom Q&A feature to ask questions for discussion and the chat feature to continue our discussion. The full participant bios will be posted in the chat for this event. The panel has representation from key players in the development of the decade. We invite you to hear their perspectives on the importance of knowledge sharing and making connections to achieve action on healthy aging. Knowledge management is about creating a set of principles, tools, and practices that enable people to create, share, translate, and apply knowledge more effectively. We will now welcome our panel participants. We will hear their initial one-on-one thoughts on knowledge sharing for healthy aging from the point of view of their countries, the UN, the civil society, the private sector, and academia. To facilitate this session and introduce the panelists, I would like to give the floor to Dr. Marta Peláez, former PAHO advisor on healthy aging and, most importantly, and as she has asked herself to do, an older person. Thank you, Patricia. And thank you so much for having invited a truly diverse, multisectoral, multidisciplinary panel with people that have a long history of working in public health and aging in the region. So welcome to all of our panel members, and our expectations are really high about the platform. As we have heard, the role of this platform in promoting collaboration as well as a discussion focused both on science as well as life experience, we believe that if we promote this platform correctly, it will enable us to have a dialogue between those who think about and study aging and those of us who live it, and therefore have first-hand knowledge of what it is like to age. This discussion will be very important during this decade to achieve the objectives we have in mind. In the region, we have a big diversity among us older adults, and hopefully this panel will help us promote action by all of the stakeholders and everybody interested in this decade so we can truly and actively use this platform. The panel will begin with very brief, like 3-minute presentations, and then we will have some time for discussion with our panelists. During that discussion time, we will share information, but it will be right after we see a demo on the platform. So we would like to begin with this panel and our first speaker, who's going to be Dr. Octavio Vergara, National Director for SENAMA Chile. The good thing about being old is that you remember the past. I remember in January 2003 when it opened. This is a model exemplary institution that is actively involved in older adults at all levels, and they have done an amazing job. So, Dr. Vergara, the floor is yours. Thank you so much, Martha. And I would also like to say that we have very fond memories of you as well. Greetings to everyone, and thank you, PAHO and WHO, for inviting our country in being part of this platform launch, im- a very important event, which will enable us to focus on the commitments of these healthy decades in its 4 areas of action. Chile, just like many other countries in the region, is aging at a very accelerated pace over the past decade. We went from having 14% of older adults in 2011 to 18% currently. By 2050, a calculation says that only 31% of the population will be younger than 70. So as a country, we have made a commitment to actively make progress towards policies that would enable us to have better healthing, aware of the fact that there are many gaps that we need to address jointly. We need to invite the entire society to have a change of mind about aging and to have communities involved. The pandemic has shown us that the older adults cannot wait, and the policies aimed at helping them cannot depend on on a specific administration or department. Aging must be a cross-cutting and collaborative issue among all of us who work in public health. So each one of us must be a true facilitator so that this commitment that we're taking can be achieved during this decade. Undoubtedly, a key aspect is to listen to the different voices by actively engaging everyone. And we have learned and we have developed a series of areas of work in our country with organizations that work with older adults where we have worked about on mental health, electoral processes, etc. On the other hand, we have been able to implement the Friendly Cities program, and 200 out of the 345 municipalities are part of this Friendly Cities program in a decision to make progress in developing programs and initiatives that are built from the bottom up. Finally, we would like to highlight the partnership we've had with the Ministry of Health in developing and implementing as people-centered model, as well as developing a strategy to mitigate the impact of the pandemic in older adults, as well as partners with the academia and civil society. Undoubtedly, collaborative work is the only way to work together and make progress in the future. And therefore, having this platform that's being launched today will enable us to share with different players all the knowledge available in order to better develop activities towards a healthier aging process. Our commitment is to work together for a decade that will leave no one behind. Thank you so much, Dr. Vergara. Yes, there are a lot of plans, and in Chile we have not only political will, but also a lot of professionals who are working in a multisectoral way. The relationship between SENAMA and the Ministry of Health would be a model for all of us to follow and to see how we can improve these primary care systems so that they focus not only in the clinical aspect of things, but also to promote it in the community through programs that can be used to improve older adults' functioning and therefore have better health. And that is the national commitment that we've had, not just a sectoral commitment. So thank you very much for your remarks. And now we're going to move on to Dr. Pablo Saar, our second panelist today. Dr. Pablo Saad is Director of CELADE for the Population Division of ECLAC. Dr. Saad has long worked in the United Nations system, and the CELADE contributions to the platform is key and very useful for everyone, both decision makers as well as civil society organizations. So without further ado, we would like to invite Dr. Saad to hear from him how he sees from CELADE their participation and engagement in the platform. Go ahead, Dr. Saad. Thank you, Martha, and special greetings to my colleagues in the panel and to everyone joining us today virtually. Let me begin by thanking the Pan American Health Organization and the World Health Organization, as well as everybody that became engaged in developing the platform on this very important effort. And I would also like to thank the organizers of this event for kindly inviting us at ECLAC to be part of this launch on knowledge sharing for healthy aging part of the UN system. It is a true honor and a pleasure for us to be part of this launch. As demographic specialists say, if the 20th century was about population growth in the region, the 21st century would be about population aging. Just like many other regions in the world, Latin America and the Caribbean is going through a unique demographic period. Never before in history have we seen this, and probably will never have this again in the future. I'm talking about population aging throughout the 60s. People 65 and older were about 8 million in the region, accounting less than 4% of the overall population. Currently, they amount to almost 60 million and they account for almost 90% of the population. By 2050, we estimate we're going to have 145 million, and by 2100, 213 million, that is to say almost a third of the total population. Likewise, with the longer life expectancy, older adults as a group are growing more. It is expected that by the end of the century, while the overall population in the region will reduce, the number of people 80 and older will increase almost 8 times, going from 12 to 92 million. Even though this might be a problem, population agency is a huge achievement because it's a reflection of better conditions of life, which has enabled people to live longer. However, this increase in the older adult population poses a series of challenges for countries in the region, including demand for long-term care, and an increased pressure on healthcare systems. These are challenges that are intensified because of an adverse regional context with high poverty and inequality rates, low quality and coverage of social protection systems, overburden of care services, mostly women, and the short, medium, and long-term effects of this COVID-19 pandemic. Therefore, it is highly timely in this region to see that starting this year, we're going to start focusing on the decade of healthy aging, which will focus on life course for universal health, and it will talk about health for development, that is to say, better managing health as part of the global sustainable development and agenda. In this sense, this platform is a key tool to support this decade, since it will enable us to share knowledge, experience, and facts among all stakeholders, private sector, public sector, civil society, academia, and others. I can assure you that for ECLAC, the platform will be very useful, taking into account all the work that we do around population aging, including the role that we play as a technical secretariat for the Intergovernmental Regional Conference on Aging and the Rights of Older Adults in Latin America and the Caribbean, which is about to have its fifth meeting that will take place in the second half of next year.
Plataforma pueda cumprir plenamente com seu objetivo, todos devemos contribuir ativa e permanentemente em sua manutenção e atualização para que a informação seja sempre relevante, oportuna e de qualidade. E desde já me comprometo, em nome da CEPAL, a cumprir como nossa parte, tratando de compartilhar permanentemente as informações com as que contamos e que são pertinentes para a plataforma. Muchas gracias.
Gracias, Pablo. Y bueno, y gracias por puntualizar que durante la década vamos a ver cambios importantes que se van a presentar en los apoyos familiares, precisamente por los cambios poblacionales. La contribución de los mayores cada día va a ser más importante en las familias, y los apoyos a los cuidados de los mayores que necesitan cuidados a largo plazo también se van a ver afectados por esos cambios en la población, la reducción de personas de edad de trabajo. Entonces, es muy importante mantener y documentar esos cambios y apoyar a los tomadores de decisiones oportunamente, o sea, sonar la alarma y promover la acción, porque nada de lo que viene poblacionalmente está por ver, todo lo vemos ya. Ya todos estamos aquí. Entonces tenemos que ver en las próximas décadas cómo esa población necesita reestructurar un poco nuestras prioridades nacionales, inversiones para ayudar ese contrato familiar de apoyo mutuo, pero que va a estar afectado por lo que estamos viendo en términos de cambios poblacionales. Entonces, gracias, tenemos mucho más que conversar. Y ahora vamos al próximo panelista, que es nuestra querida doctora Elena Restrepo. La doctora Restrepo, como podrán ver por su biografía, ha contribuido a la salud pública en la región por muchos años. Ha influenciado en la vida profesional.
Has influenced the professional lives of many of us. And I will say that I'm the first one to have been impacted by her and continues to be impacted by her. Out of all of these panelists, Dr. Restrepo is perhaps the one who has the most complete understanding of what the platform may represent, both for decision makers and for civil society, and also for retirees. So thank you very much, Restrepo, for being here today. The floor is yours. I thank you, Marta, my dear friend, from whom I have also learned a lot while you're at your position at PAHO. Good day to everyone, and I'm very pleased to be with all of you, and I very much appreciate the invitation to speak on this very important panel as an older person on behalf of civil society. I am at the edges of my older years, and I am a retiree of the Pan American Health Organization. I fortunately am very physically and intellectually healthy, and above all, very active. I live in an institution that was designed under a model of active and healthy aging, which I wish we could see devoted to adopted by everyone working with older adults at all socioeconomic levels. The advantage for me has been the ability to see how everyday policies and strategies to promote health are more relevant in the region of the Americas. And it was not easy to achieve this for those of us who were the first ones to promote this starting in 1986, the year of the Ottawa Declaration on the Promotion of Health. The decade, which has been happily adopted by the United Nations and which brought us here today, is a challenge for health authorities and for everyone who works in the fields of geriatrics, gerontology, public health, mental health, as well as centers and institutions to care for older adults. They all have a tremendous responsibility, and also this falls to the social sectors of the countries in Latin America to promote research, continuing education, the development and establishment of healthy public policies for older people, and sources of financing for projects and programs, and above all, to support through social justice the most vulnerable older people, such as women and victims of inequity that continue to exist in our country. Finally, I wish to tell you that I firmly believe that one can age with great possibilities in areas such as continuing education, art in its various manifestations, literature, the fight against violence, all within a context of civil ethics and respect for the dignity and human rights of the aging person. Thank you very much. Wow, says Marta Pelaez. Thank you, Elena, because you have really covered everything. But what really resonates is how we are starting the decade with a public health view, but at a moment in which we must also look at how students, public health decision makers need to understand what healthy aging is. And of course, equity as one of the essential components. It is very easy to think of healthy aging theoretically, but if we begin to think about healthy aging of people who have systematically been excluded and have marginalized from services, programs, and meeting their basic needs in life. So we, as older people, need to be the voices that will continuously push to ensure that the context of equity in older age is not forgotten. It shouldn't just be left to theory. In practice, we need to see the necessary advocacy so that all older persons can enjoy an old age with dignity and enough resources to continue to live the way they would like to live. So thank you very much. Dr. Pelaez, excuse me just a moment. I just want to say something to the interpreters.
You need to change the output to the
Yes.
corresponding channel. Thank you so much. Adelante.
Please go ahead. So now we will go on to our next panelist, who is a woman, Yasmin Diaz-Quicho, who is the Director of Advocacy on behalf of the Global Coalition on Aging. This coalition is a set of companies and industries that are interested in contributing to a radical change in the way that we look at aging. So thank you, Yasmin, for being with us, and you have the microphone. Good afternoon and good morning. Thank you very much, Dr. Pelaez. As you said, I am Yasmin Diaz-Quicho, and I'm the Director of Advocacy for the Global Coalition on Aging. I am very proud to be here with all of you. The coalition is honored and delighted to be part of the launching of this platform. I am here today because our coalition is a voice that brings together international organizations that are highly interested in aging. We represent a sector that plays an important role to ensure that the decade of healthy aging will be a great success. As we know, and as other panelists have said, in 2050, there will be more than 2 billion people over 60 years of age in the world. And this is acknowledged and celebrated by the decade of healthy aging because aging is a tremendous trend with huge consequences. We know that together we can highlight issues such as the need for integrated care in around health to eradicate discrimination based on age and other issues related to health, such as health and vision, bone and vision health, and cardiac health. And we must look at the measures needed to be taken in order to ensure that we continue down the path to healthy aging. The coalition can contribute to this healthy aging of the population, both socially and economically. In order to realize this potential, it is not only important but imperative that public and private sector work together to allow populations to achieve their full potential over the life course and particularly in the advanced years. We also believe that companies play an essential role that enhances the private sector to work for the common good. We believe that by putting together the experiences of all companies in all sectors has great potential. This, for example, includes health systems, pharmaceuticals, technology and transport, and the care of older persons at home and financial services. The private sector has the capacity to expand innovation that can be leveraged to achieve healthier and more active aging for all. We also point out that companies are comprised of people, and these people are also part of our community. These communities are also comprised of employees who represent a large collective of millions of workers who can act as powerful defenders of the decade of healthy aging. Through our members, the coalition is encouraging change in favor of healthy aging, and by encouraging companies to align with public policy and to actively contribute to expanding knowledge on the process of aging. Having said this, the coalition welcomes the creation of this platform, which truly is a crucial tool that all stakeholders in academia and civil society, governments, and the private sector and international organizations can take advantage of in order to move forward the agenda of healthy aging nationally, regionally, and on a global scale. We're very thankful for being included in this platform, which strengthens our commitment to public-private partnerships, and we are very excited to hear today's conversation. Thank you, Yasmin. Yes, in fact, this dialogue between the public and private sector, civil society is important because the work ahead of us is monumental. And we only have 10 years to do this. That's not enough time. And also, everyone needs to invest in this. Everyone must invest in this process. It is one thing to talk and another thing to move. And in order to move, we need a lot of resources, but not only monetary resources, we also need human resources. And as you well stated, amongst these companies, there is a large number of people who are seeing aging of their family members, and this motivates them to work towards and promote healthy aging. Yes, we're going to see how we can put these desires and principles and ideas into practice as we discuss this in our panel. Thank you, Yasmin. Thank you. Now, our next panelist is Dr. Carlos Cano. He is the founder and president of the Latin American Academy of Medicine for Older Adults, ALMA. It was created to foster the training of physicians in geriatrics. He is not only a professor, but Dr. Cano is also a researcher and a leader in geriatrics education. So Carlos, I don't see you. Here I am, Marta. Yes, great. All right, I'm so glad. Thank you very much for that very generous introduction. And I will take my 3 minutes, don't worry. But first of all, I'd like to tell you that our academy was born 20 years ago under the umbrella of the Pan American Health Organization, and Marta Peláez was the person who accompanied us at that time. So Marta, it is thanks to you that ALMA is where it is today. We are a group of geriatric medical school professors, and we've been collaborating in this network for 20 years to have the 333 geriatric physicians trained from Latin America and Spain, and about 3 courses have been done. 166 people have graduated, and we're very proud of that. So, of course, responsibility for geriatrics and for the Academy is very important in terms of the launching of this platform. We are committed and we will be inclusive, and we want to actively participate in the platform to be part of this UN initiative, and also with the sponsorship of the Pan American Health Organization and with the follow-up of all of the colleagues who are involved in this. Aging in our region, as has been said, is a reality. This is the increase in the population of older adults. This means that we have more people who are older. They're very old, and we will have a fourfold increase in this number of people. And this not only affects healthy aging, people who could get to their 80s or 90s or become centenarians, but we also need to accompany them throughout the life course with healthy aging. The pandemic has posed great challenges because we've seen how the older population has suffered, but we have triumphed over this, and the vaccination programs, thanks to the commitment of our nations and governments, has been very good in terms of vaccine coverage. I think that ALMA's role is aimed at research and papers, but also papers that contribute to healthy aging, in which today we have a lot of knowledge about this. We have many tools that allow us to intervene to bring about healthy aging. One of them is the ECOPE tool that you may be familiar with, but those who are not can consult it. And of course, this is one of the starting points for working in an interdisciplinary fashion, which is essential. We all need to do this. So it's not only physicians and geriatricians, but we need to have social involvement and work with civil society and our colleagues, and with the public policy decision makers and all work together towards healthy aging. Thank you very much for the invitation, Marta, and I thank to the organizers for including our academy in this event. Thank you, Carlos, and I have many questions for you, but I am going to wait until we have our discussion time to ask them, because I think that the role of gerontologists in the region who work hand in hand with health experts public health experts can make a major difference. So now we will go on to, before we leave, before we get into the discussion, we invite Brenda to tell us about the platform itself. Brenda is the PAHO technical person who is going to be running the platform. So Brenda Cadena is going to give us a little bit more information about the platform itself. We will learn from her not only what the platform is, but how we can use it. And so Brenda, please take it away. Thank you very much, Marta. Today, we have the pleasure of launching the platform of knowledge for healthy aging in Spanish. This is a space in which all stakeholders throughout the world can collaborate with their peers, colleagues, professionals, experts, and others to find, share, and produce knowledge on healthy aging in a single place. The speakers have spoken about the various ways that the knowledge sharing is important to foster healthy aging, and even more so to work together. We have also heard from the main stakeholders in more than 80 countries to learn what the best way is to foster the necessary collaboration so that the decade can be successful through the platform. How can the decade help us work together to share our knowledge and experiences to improve the lives of older persons, their families, and their communities? The platform supports stakeholders in creating collaboration to foster healthy aging, allowing all of us to find, share, and produce the knowledge that we need together with friends, colleagues, and professionals, experts, and others in English, Spanish, and French. The knowledge on the platform is organized into 5 categories that correspond to what we call the facilitators of the decade of healthy aging. Voices. This is where you can find the histories and experiences of older persons, their families, and their communities, which are at the center of the decade. Then you have resources, which is where you can find information on publications, databases, multimedia, events, comments, and news on healthy aging produced by the stakeholders from throughout the world. Then you have Connect. This is where you can access a directory of people, organizations, and networks that work to foster healthy aging. Innovate is where you can find detail on projects, campaigns, research, case studies, and other initiatives that are aimed at innovating to create new knowledge and new interventions for healthy aging. And finally, Support. This offers information on the tools, practices, and training programs. And any of these places, you can share your knowledge, experiences, and skills according to the type of knowledge available on the platform. And this becomes increasingly useful as people contribute to it. So let's say you're a person working for a local government who has responsibility for reducing age-based discrimination to foster multi-generational collaboration. So you could go to find knowledge, you could click on publications here under resources, and then find all of the publications that stakeholders have shared on ageism and find what you need to plan your intervention. You can see that there is a broad array of knowledge that can be used, not only under publications, but also to learn more on ageism and healthy aging. And this government representative could look at databases and clearinghouses of information on aging, or go to voices and hear from older people themselves to learn more about what matters to them. And if you are the representative of a local civil society organization and want to learn more about how to become an ethical leader for aging, you could click under knowledge and then go to training programs. Under support, and then you could find free online courses to hear about the development of the skills that you need. Once you have done this, perhaps you want to look for other organizations and go to Connect and get in touch with them. Perhaps you are a private sector professional who wants to connect with civil society organizations and local communities for a corporate social responsibility project aimed at older persons and their communities. You could go to Send and provide the information on your organization, or you could also go to Connect, as I told you before, to look for persons and organizations to connect with. You could also share information on your own initiative under Innovate. Research projects, for example. And there you could include your information under innovation, and there you can upload your information so that anyone can find it. The potential for what we can achieve together using the platform of the decade are tremendous, and it's only limited by our imagination and our actions. You just have to tell us, as I said at the beginning, who you are and what you are looking for. And you can give, this will give you suggestions about how to get started, or keep watching it. We keep adding new things, such as an online debate forum that we hope to add this year. Or if you have a bigger idea regarding knowledge and the platform, please get in touch with us. For example, at present, we are looking at ageism over the ages. This is an invitation to submit proposals over the next month and a half on events and initiatives that point out the importance of this topic. The platform is for everyone, and we're all very pleased to work with you. We're citing the type of information that governments, international organizations, community, civil society, and people throughout the world can share on this platform for the decade, and how the stakeholders will use this knowledge to change the world. So thank you very much for your attention, and I hope to see you soon on the platform. Dr. Pelaez now says, thank you. Thank you, Brenda. And as the PAHO focal point for the platform, we know that you are going to be very busy, and we will be in touch with you as we learn how to use it. As you very well stated, this platform is a tool, and like any tool, we need to learn how to use it, and we have to figure out the best way to use it. Over the course of the decade, we are going to create new opportunities for the use of the platform. But the important thing is to use it. And by using it, we not only learn how to innovate, but also how to collaborate. I think that the platform really stresses that we must use it because the content of the platform will not just be the responsibility of PAHO, but rather of all of us. We need to share and collaborate. Now, we will bring our panelists back. I think everyone on the panel can turn on their cameras because now we are going to have a little bit more interactive session and we are going to delve further into the topics we've been discussing. All right. Can everyone hear me? Is everyone here? Yes, perfectly, Marta. Yes, and now we need Dr. Restrepo, who's here. And is Paulo Saad here? I don't see. Yeah. Oh, I'm sorry, I don't see him. Yes, I'm here. Okay, great. You're there. All right. First of all, I would like to ask each of you from your own perspective, both professionally and personally, now that you have seen the platform, how useful do you think it will be? And how do you think that you will contribute to it and also enrich the content on the platform? And let's start with Carlos because he was the last one.
Perfect. I'll be brief so that I can give a chance to everybody to talk. I believe that the platform is not only an opportunity, but a dream that we envisioned to be able to integrate information in different scenarios, be them synchronic or asynchronic, and also to take advantage of the opportunities we have today and that for different reasons we cannot spread. In spite of all the ITCs, information technology, communication technologies, we cannot talk about, vaccination or healthy living practices or better hearing or vision so that we can have an impact on healthy aging. So I see it as a huge opportunity for us, but also to be able to include elements such as research and experience from other colleagues. Thank you, Carlos. I'm being told that we need to wrap up because we are past our time. So just give us a couple words, your thoughts. How do you think the platform or the coalition can use the platform and contribute to it? Thank you for the question. We believe that the platform is a mechanism that it will enable us to spread information, and the resources of our coalition can be made available so that all the stakeholders can take advantage of this in different countries. It will also enable us to learn from the experience from other stakeholders and key players in healthy aging, and the platform will also enable us to identify existing gaps in the objectives for healthy aging, which is of course an opportunity for all of our members to contribute with experience from the private sector so that together we can find a way to achieve these goals. Thank you, Jasmine. Dr. Restrepo, how do you see older adults in this? In the pandemic, somehow we all became a little bit more used to this virtual world. But how do you see older adults using this platform? How can we promote the use of this platform among older adults? Thank you, Marta. I believe it is a challenge, like I said during my remarks. It won't be easy. Actually, it will be hard. It will be hard to, first of all, have that interaction between the different scientific societies, civil society, business associations, etc. That is a challenge, and it's going to need a lot of human resources promoting all of this. And from the civil society, I believe there's a lot of potential. However, we need to look for it. We need to look for leaders, leaders in the civil society. And that will help us have a better use of the platform, because otherwise it just becomes something for the academia that only specialists will use to see what the latest research says, and it won't be very practical for everyone. So I think we need to engage the different entities that work with older adults in the different countries or cities. Thank you. Thank you. And to that, we add the issue of how to make older adults from different education levels or different interests, how we can get them engaged, because we cannot be discriminating against anyone. We need to hear everyone. And I believe community leaders will play a major role in this. So that's the message from you, and it will be a challenge for PAHO and for everyone that's supporting the development of this platform. Please bear that in mind. We need to find community leaders that will allow us to hear the voices of these older adults regardless of where they are. Thank you. Paulo, go ahead.
Yo creo que hay mucha información
I believe that there's a lot of information that has to do with this decade of healthy aging, but it's spread out. So the advantage of this platform, just like of any other platform, is to bring all this, gather all this information in one spot. And this will be of much more benefit for everyone. Now, it will be a huge endeavor, and it will require a lot from many of us in order to meet this objective. I'm familiar with a lot of experiences that started off very well with a very noble goal, but over time, because of lack of updating or maintenance or other types of difficulties, it kind of fades out. So I believe that it will be very important for everyone to make an effort so that we can make sure that it is useful and it meets our objectives. And another thing that I mentioned during my presentation, ECLAC is a technical secretariat for the Intergovernmental Regional Conference on Healthy Aging and the Rights of Older Adults. And I believe that this is a very good platform to introduce the topic of not only the decade of healthy aging, which of course will be part of our agenda for our upcoming conference, but also to spread the news and to call on the governments and civil society organizations in the region so they can use the platform, so they can become familiar with it and use it. And that will be the commitment that we show with the platform. Thank you. And maybe we also need to make it available to different sectors, because humanities, social sciences, etc., hold a lot of wealth and knowledge that can be used to increase our knowledge on how people experience aging in the different populations in our region. So we need to invite all these other sectors, anthropology, sociology, psychology, humanities, like I said, to join the platform. So at some point, we need to invite them directly so we can attract those groups. So now, without further ado, I would like to thank our panel. I would love to keep talking with you for one more hour, but unfortunately, I'm not allowed to do that. So without further ado, I would give the floor to Patricia, who's going to lead the rest of the webinar. Patricia, the floor is yours. Thank you very much, Dr. Marta Pelaez, and thank you so much to the panel that provided us with important perspective on the use of this platform for healthy aging. Today is another key step towards transforming the world into a place where we can add life to years. I would like to thank the audience that joined us today and the speakers for the rich and engaging discussion on knowledge sharing and collaboration to advance healthy aging. Thank you so much for all the questions and comments that we received in the chat and during the questions and answers session in Zoom. And without further ado, I would like to turn the floor over to Dr. Rica Vega, Head of Healthy Life Course Unit at PAHO, to close this event and share with us how we can be part of this decade of healthy aging movement through the platform. Thank you, Patricio. We're a little bit behind, but I would like to take this opportunity to, first of all, thank all of the participants and our panelists and all of those that have contributed through the chat, as well as all of you who will continue to be present in the everyday use of this platform. I believe that knowledge sharing and building evidence and sharing experiences will enable us to transform the way in which we see, think about, and address the needs that relate to aging and old age, which are key for this decade. And the platform will be the tool that would enable us to do our work on a daily basis around all the transformations that we need. So all I have left to do is invite you to participate in this decade by actively using the platform on a daily basis. And there will be three different ways. There will be three different ways in which you can participate in decade. One is to visit the decade, to have it under your favorites in your web browser and have it available as a tool. The second one is to share what you know, share your experience and knowledge, publications, etc., data and progress on what the countries or municipalities are doing, what's taking place, what will take place in the next stage. This is a way of keeping us all active and involved in what we're doing at the global, regional, national, and most importantly, local level and have, which is a democratic right. And finally, help us spread the word about the platform, talk about it. Like Dr. Restrepo said, we need older adults, civil society, professionals, etc., to know about this tool, which gathers information and knowledge. So with that, thank you once again for joining us today. I hope that you can live a healthy life, take care of yourself, and please continue to contribute so that we can build a world in which everyone can live long and healthy lives without leaving anyone behind. Thank you so much, everyone, and we hope to see you soon.
Muchas gracias a todos. Nos vemos en la
Thank you
plataforma.
so much, and we'll see you at the platform.